Hey y'all, I'm Dee Dee with Beauty Pixie. Welcome to my channel. This video is part 3 in our series, Skin Explained. And today we're going to be looking at disorders of the skin, or some of the most common disorders that I see. We're going to talk about acne, eczema, psoriasis, vitiligo, rosacea, hyperpigmentation, a compromised skin barrier, and skin cancer. Let's start with number 1, acne. Acne has long been thought of and treated like an infection of the Cutibacterium, or it was formerly known as the Propionibacterium, less formally known as C. acne bacteria or P. acne bacteria. This one-size-fits-all mindset led sufferers to give up on the hopes of ever having clear skin. Acne is actually an umbrella term. At the root, it has numerous causes and just as many treatments. Traditionally, dermatologists have prescribed things like Accutane or tretinoin to treat the symptoms of acne. But unless you get at that root cause of the specific kind of acne, these treatments are no more than just a band-aid. These pharmaceuticals can help with these symptoms, but you've got to suss out the root cause. Some of these root causes can be hormonal, gut imbalance, blood sugar imbalance, inflammation, or infection. The infection can either be bacterial or fungal. And even with these, the even further roots to find out why the body is inflamed, why the gut is out of balance, why the blood sugar is out of balance, the imbalance of the microbiome that can lead to the bacterial infection or the fungal infection. It is crucial to link up with a provider who will suss out these root problems and treat as an individual, because these one-size-fits-all treatment plans, they're not for everybody. If you have struggled with acne, and you've tried numerous different things, link up with a professional and have them do an assessment on your skin, ask some really probing questions, and find out the root cause of your acne. And that's where you can have your plan of attack. Our next common skin disorder is eczema. It's also called atopic dermatitis. Now, this one is near and dear to my heart because my son suffers from this. It is a chronic condition, often starts in childhood. It's characterized by dry, itchy patches along the skin. In a lot of people that I know, it starts in the crease of the elbow, maybe behind the knees, the neck, sometimes the hands. And it seems to be associated with areas of the body where we have more heat and moisture. The itchiness and dryness leads to scratching, and that leads to irritation, and that leads to inflammation, and that leads to the skin getting thicker and drier and itchier. It's kind of an endless cycle if you think about it. Now, doctors don't know the cause of it. They think there's a genetic component or maybe environmental. But I know one of my friends who is a nutritionist. Her daughter had I don't know if it was atopic dermatitis or psoriasis, but it was found to be linked to her gut. And once she did an elimination diet, she was able to heal her skin. And I have noticed that with my son, his flares happen more when he is stressed out, and also when his diet gets really trashy. He'll break out more, but stress seems to be the main trigger for his. And usually the treatment for it is that they'll tell you to stop scratching. They'll tell you to just keep the areas hydrated using like petroleum jelly products and things like that. I like to take a little bit more of a holistic, natural approach and find out why. Why is your immune system overreacting? Or why is it that these areas of your skin are very irritated, inflamed? Suss out that root cause and try to heal it that way. Now this next one sometimes gets confused with eczema. It is psoriasis, but psoriasis is completely different from eczema. Like I said in a previous video, one of the fundamental functions of our skin is protection, and it's linked to our immune system. Well, in psoriasis, the immune system goes haywire and it overproduces skin cells, which leads to patches of red, silvery scales in different areas of the body. Often the scalp, the hands, the legs. They're usually very itchy, very painful. And it's thought to be an autoimmune disorder. And it's basically your body's way of kind of attacking itself. Now, if you have psoriasis, unfortunately, you're also at a greater risk for heart attack, stroke, certain types of cancers, diabetes, liver disease, and kidney disease. And that's one of the reasons why they think that it is some type of autoimmune disorder going on. If you follow Dr. Lee, Pimple Popper, you'll know that there are some great biologics that have come on the market recently that can help with this condition. Before, you were put on immune suppressants, which is kind of a double-edged sword, because if you suppress your immune system, you're more likely to get sick, you're more likely to get cancer. And so these new biologics work in a different way to kind of quiet that certain thing that attacks your skin cells. I don't know all the science behind it, but I have seen that these new biologics do work really well with psoriasis and help alleviate some of the damaging effects that this disease does have on the body. Up next, we have another autoimmune disorder, and this one is vitiligo. Vitiligo is where the immune system attacks the melanocytes, the cells that are responsible for producing melanin in our skin. It's more noticeable in darker skin tones, but anyone of any skin color can have vitiligo. Some people, it just presents on maybe their hands or legs, and some people have it all over, but it's always bilateral, meaning you have it on both sides of your body. Now, some people may self-diagnose and think that they have vitiligo, but it's actually a fungus that can kind of mimic it. But the fungus can be treated and cured, but vitiligo, to my knowledge, has no known treatment or cure. The next one is one of my favorites along with acne, because it's something I can actually help with: rosacea. Rosacea is a chronic inflammatory skin disorder. It's kind of a hot button issue between dermatologists and estheticians. It's characterized by excessive flushing throughout the center face, and it can be accompanied by pustules or pimples. It looks like adult acne, but it looks like you're always embarrassed. And it's different from when you actually flush from exercising or from being embarrassed, because it never truly goes away. The skin where the redness is carried is often really warm or sometimes hot to the touch. This chronic inflammation can cause an overgrowth of little blood vessels in the skin called telangiectasias, especially on the nose and throughout the cheek area, but also in the chin and in the forehead, can cause a condition called rhinophyma. And that is typically where the nose will enlarge and it kind of gets really bumpy, almost mutated looking. And it's just the inflammation that the body doesn't know what to do with. And it just fills the nose with all these blood vessels, and it overproduces the sebum, can really disfigure the nose. And it used to be called the drinker's nose or the alcoholic nose because it was mistakenly linked to alcoholism. Now, the reason why certain people develop rosacea is completely unknown, but it is an inflammatory disease, so it's linked to some type of inflammation. People often with rosacea have flares. Flares meaning the condition worsens than other times. And common triggers for flares are heat, which can be sun exposure, or hot showers, hot baths, saunas, hot tubs, sometimes exercise, spicy foods. And then a big trigger of it is alcohol. And there again, it's because alcohol creates internal heat. Kind of like, when we were kids and you would see the cartoon of somebody getting stuck in an avalanche and they would send out the big St. Bernard dog with the barrel of rum or whatever it was under his chin, because they believe that if you drink alcohol, it makes you warm. It doesn't actually make you warm. It dilates your blood vessels and tricks your body into thinking that you're warm. So a lot of people who drink, they will get sweaty. And it's because your body thinks that you're hot and you're not actually hot. It's the reaction to the alcohol in your system. A big trigger is stress. I know, stress is unavoidable, but stress is also responsible for a lot of things that go haywire in our system. One thing people don't understand is our skin shows what's going on the inside. And some people are sensitive to foods like nightshade vegetables, potatoes, tomatoes, react differently in some people, and it causes internal inflammation. And what happens on the inside eventually comes out on the outside. So if you've got that internal inflammation caused by gluten sensitivity or these nightshade vegetables, it's eventually going to come out in our skin. And so a lot of estheticians believe that these two are linked. We know that there is a link. There is a brain-gut link, but we estheticians know that there is a skin-gut link too. And it all is based around our immune system and our lymphatic system. And now we've come to my nemesis, hyperpigmentation. And like a lot of the things that we've talked about today, hyperpigmentation is a little bit of an umbrella term. But under that umbrella, you have your dark spots caused by UV damage and age, solar lentigines, what we used to refer to a long time ago as liver spots. And then also under that umbrella, you have melasma. Now, both of these issues are something that I struggle with. Let me see if I can show you some of mine. Like these patches right here. They're usually where the sun hits, usually the cheeks, sometimes the forehead, and those are just from UV exposure. And the longer you live, the more UV you get exposed to, and the darker these patches can get. Now, some things you can do for those is be on a pigment inhibitor, and there are also treatments that can help lighten these spots up. Now, the other condition, melasma, that is one of the hardest conditions in aesthetics to treat because it's hormonal driven. It's thought to be initiated by sun damage that's already there, and then the hormones come in and play a part of making it flare. And unfortunately, a lot like rosacea, heat, sun, all the things that flare up rosacea also can flare up melasma. Now, melasma is characterized, typically you either have the butterfly pattern, where the melasma is mostly in this area, or you have the halo pattern. I have both. So I have a little bit out through here, and I also have the halo around here. Now, some people will also develop melasma over their top lip, but it's not always melasma. Sometimes if you have someone who develops melasma on their top lip, but they're also getting their top lip waxed. It can be the other condition under this hyperpigmentation umbrella called PIH, which is post-inflammatory hyperpigmentation. Now, this can happen post-inflammation, which can be due to waxing. It can also be due to acne, like when you get rid of the acne lesion, but you're left with a dark mark there that takes forever to fade. That is post-inflammatory hyperpigmentation. Usually the acne dark marks are worse for people with darker skin because it's more noticeable. Usually in lighter skin tones, it'll just be red for a while, maybe a little bit dark, but not very noticeable. But unfortunately for people with a lot of melanin in their skin, those spots are really, really dark. But it can also happen, like if you wax your underarm, sometimes you can get post-inflammatory hyperpigmentation there too. And also in our genital regions. Sometimes that just happens because of it being a place of friction. And if you've ever noticed, if you carry a little extra padding like I do, where your thighs rub together, your thighs can be darker too. And that's just because of that friction creates inflammation, and you're left with hyperpigmentation. Now we've got compromised skin barrier. That's kind of an umbrella term too. But the skin barrier is a system, and it's mainly comprised of the acid mantle, the microbiome, and the stratum corneum. You remember that from episode 1 where we talked about the anatomy of the skin? This system works together to protect our skin. It is the first line of defense that we have. Well, a compromised barrier happens when that system is disrupted or wrecked. This can happen by either the overuse of exfoliants like scrubs or even acids. It can also happen when you're on too strong of actives or use them too often. This also can happen if you just don't take care of your skin. If you don't use protection like sunscreen, or if you don't use a moisturizer and your skin is exposed to sun and the cold, the heat, all of that, you lose a lot of the moisture and the water in your skin, and it compromises that barrier. Now, if you noticed, part of that system is the acid mantle, because skin is naturally acidic. That layer on the skin is acidic. So if you use regular soap on your skin, soap is alkaline, which means it's higher on the pH scale. So using that harsh soap can wreck your barrier too, because it breaks down the acid mantle. And once the acid mantle is compromised, it's pretty easy to compromise all of the other stuff too. That system works in harmony to protect the skin. So we really want to care for our skin barrier so that it can protect us. And last, but probably most important, the main dysfunction of the skin, the most serious, is skin cancer. Skin cancer, unfortunately, happens as we age and our body no longer fights the cancer cells that we were born fighting, and along with UV exposure, can mutate the cells of our skin. There are several different types of skin cancers that happen at different levels of our skin, some more serious than others. But everyone should have their skin checked by a medical professional. Whether you see something or not, get checked. There are areas of your body that you're never going to see. Your scalp, your back. We may not notice subtle changes over time because we see the same areas over and over again. But a doctor who knows what they're looking for and only sees you once a year is going to notice these changes, and they know what to look for. The main thing to remember about skin cancer, well, there's two: prevention and early detection. A lot of us, we grew up baking in the sun, laying on the trampoline, slathered in baby oil because dark was in. The darker you were, the prettier you were, whatever we bought. Well, that damage is catching up to us, whether it's in signs of aging in our skin, whether it's hyperpigmentation or rosacea, whatever it is. Cancer, that's a scary one. So get checked. Wear your sunscreen. Wear it every day. It not only protects you from damage that ages you, it can protect you from damage that can kill you. And also protect your children. Whether you think that they're going to be out in the sun all day long and babies look cute with a little sun-kissed glow. That sun-kissed glow is damage. Protect your children. Put sunscreen on them. Our parents didn't protect us, and now we are getting to the age to where trips to the dermatologist are no longer fun because they're cutting chunks of our skin out. It's serious, y'all. Protect yourself and get checked. Thank you so much for watching this video. I hope you learned a little bit more about some of the dysfunctions of skin. In the next video, we are going to talk about what we can do about some of these dysfunctions and how we can improve our skin, not only for the look of it and for our self-confidence, but also for our health. So tune in next time. Thanks, y'all. Bye.